have a team of public health nurses who go out into the community and meet with young families so there's such a growing number of newly arriving families in Minnesota. Families speak Spanish. Just the sheer number of them exceeds the number of interpreters available. In order for our staff to be flexible to meet the families' needs, we struggled to find interpreters that were available, that are high quality, that have some medical background that we can hire. Has been really challenging. And so we were really struggling to meet the needs of the families that we need to be able to do in a way that was culturally responsive. One of the county's core values is around resident first, because so many people speak another language, and language barriers can lead to all sorts of detrimental health outcomes that we're trying to avoid. So the actual need came from the nurses themselves. They just were getting exceedingly frustrated with not being able to meet the family's needs. They'd have to reschedule appointments, push appointments out too far, maybe use a video or a phone interpreter when they preferred an in-person interpreter to have a challenging conversation. So that was some of the impact to nurses. Impact to families, just lower quality of care, because you can't get the service you want at the time you wanted it because they're just not available. And so we were looking for a staff development opportunity. So we were looking for a program that was super flexible. We had continuum, some with very, very basic Spanish or maybe no Spanish at all to people close to passing the proficiency tests, but just needed a little extra support from a teacher. So we were looking for flexibility of creating a program that would work for each individual student. And then we were honestly looking for somebody who was easy to work with, that had great reputation and would be easy for us to figure out the contracting. I'd say probably the top is that it has really increased the engagement of our team. The nurses are just truly excited about being able to speak more Spanish and being able to meet the needs of families. And we have a couple nurses who are feeling actually really prepared to take up language proficiency tests very soon. There's very few times where, as a leader, I have been able to find something that really truly makes a difference for the nurses, and I think that the staff are just really grateful. It's been a great experience for us. Live Lingua has been easy to work with, has been flexible to meet the needs of our nurses, busy during the day, and has worked around their schedule. And we've definitely started to see success, which is really what we were looking for. So I think if you're considering using Live Lingua, I would definitely say go for it.